of coffee, sit back and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life features stories to inspire and motivate you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. Visit cyacyl.com.
Welcome to Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in. Did you know that a staggering 1 in 2 Americans suffers from a condition of metabolic imbalance and disease that ranges from mild blood sugar imbalance to full-blown diabetes, and that this condition is one of the leading causes of heart disease, stroke, dementia, and cancer? Did you also know that the American lifestyle and diet is causing us to raise a generation to live sicker and die younger? Today's guest, Dr. Mark Hyman, has dedicated his career to identifying and addressing the root causes of chronic illness through a whole systems medicine approach known as functional medicine. Dr. Hyman is a family physician, a 4-time New York Times best-selling author, and an internationally recognized leader in his field. He strives to empower others to stop managing symptoms and to treat the underlying causes of illness. Dr. Hyman is chairman of the Institute for Functional Medicine. He's a medical editor at the Huffington Post, is on the medical advisory board of the Dr. Oz Show, and is on the board of directors of the Center for Mind-Body Medicine. Dr. Hyman has testified before the White House Commission on Complementary and Alternative Medicine and has consulted with the Surgeon General on diabetes prevention. He's tested before the Senate Working Group on Healthcare Reform and Functional Medicine and participated in the White House Forum on Prevention and Wellness. He continues to work in Washington on health reform, and he's worked with President Clinton and the Clinton Foundation. Dr. Hyman's new book is entitled The Blood Sugar Solution. Dr. Hyman, thank you so much for joining us today.
No, I'm thrilled to be here. Thanks for having me.
Dr. Hyman, raising a generation to live sicker and die younger. Those are very scary words. What do those words mean to our future generations, raising a generation to live sicker and die younger?
Well, it's pretty scary. Yesterday I was at a panel on Emory University about diabetes in children, and I talked to a gastroenterologist from Emory, and he said, we're seeing now cirrhosis of the liver in 5-year-old kids from the effects of drinking soda and sugar in our population. We're seeing kids who are 5, 8 years old having strokes, 20 years old having cardiac bypass surgeries. This is really criminal what's happening to our children, and it's not getting better. Our children are getting fatter, they're getting sicker, and so are we. And we need a solution for this. We can't keep going on expecting that medication or surgery will fix us because they don't.
Well, and I'm a child of the 60s, and I remember so often we talk about how when we were growing up, you had maybe one child in the classroom that was overweight, and the rest of us, we went out and played all day. And so what was it that we were doing differently back then that's not happening today?
Our food supply has dramatically changed. We think we're still eating food, but we're really eating factory-made science projects that look like food. And they're not necessarily doing the things that they need to do to keep our bodies healthy. For example, we introduced in this late 70s, 80s high-fructose corn syrup, very different food, and it has the ability to increase fatty liver. Like we talked about in this 5-year-old kid, it increases the risk of diabetes and central obesity. And so everybody's getting these big bellies. We've seen obesity rates skyrocket in the last 30 years. We've changed our sugar consumption from 10 pounds per person in the early 1800s to 150 to 180 pounds for every single American every year. That means that's average of a half a pound a day of sugar. The average 20-ounce soda, we used to have 6 to 8-ounce sodas, now it's 20 ounces, and people drink them all. That has 17 teaspoons of sugar. People have no idea what they're consuming. Flour, we're consuming about 55 pounds of flour a year. And this is from wheat, and wheat is not what we used to eat. It's the wheat that is a dwarf wheat that's different from our ancestral wheat that our grandparents made bread from. And its wheat has a super starch that raises your blood sugar more than table sugar. So 2 slices of whole wheat bread will raise your blood sugar more than 2 tablespoons of table sugar. So these combination of factors, plus environmental toxins, plus the effects of certain medications on our gut flora, like the overuse of antibiotics, plus chronic stress, plus increasing screen time. The average kid spends 7 to 9 hours in front of a screen every day. So does the average adult. How does that affect us? We're sedentary, we're not moving. So all these factors combined in the last 30 to 50 years have really changed our population from relatively healthy to massively obese to, think about it, almost 3/4 of Americans are overweight, and some populations even more. That means it's not normal to be thin or normal weight. If you were a Martian and you came to America, you go, gee, it's normal to be fat.
Right.
And you'd see also that chronic disease is a foodborne illness. that we ate ourselves into it, and we have to eat ourselves out of it.
Well, and the interesting thing about what you're saying is that, poor diet, chronic stress, microbes, toxins, allergens, these are all things that we do have some degree of control over. So why is it that we feel we're so powerless when it comes to our health? You'll hear people say things, I got diabetes, I got high blood pressure,
Like you caught it like a cold.
Right. So,
That's right. This is the problem. We think of these diseases as things. I got this, I got cancer, I got diabetes. You don't get them. They emerge from disordered patterns of your lifestyle interacting with your genes, and they're things you have complete control over. In fact, when you go to the doctor, they know what to do for serious illnesses. They learned medicine in acute care hospitals. They don't know how to treat chronic illness. I didn't learn that. I mean, think about it. Most doctors know more about treating malaria than treating obesity and obesity-related diseases. Mm-hmm. So we can't go to the doctor to get help. I mean, they can rescue us from disaster, but that's about it. And so we have to say, where does health happen? Health doesn't happen at the doctor's office or in the hospital. Health happens where we live, where we work, where we eat, where we breathe, where we go to school, where we play, where we pray. That's where health happens. And we have to figure out in our own lives how to create health in our worlds. And I think that's something that we can do. And I've seen by people making a few simple steps that they can take back their health, that they can reverse diabetes. I mean, I had a guy, George, recently, after about a year, I treated him. He was 300 pounds. He had diabetes. He was 63 years old. He had angina, heart failure. He had reflux. He had sleep apnea. He had low sex drive and function. He had, you name it, he had it, low thyroid. Mm-hmm. He said, could you help me? He was on 9 medications. I said, sure, George. He said, but you have to do everything I say. And I said, well, he said, okay. So he did it. He actually did it. He changed his diet. He exercised. He did the supplements. He just maximized his biology and created health. And a year later, he lost 150 pounds. And it wasn't difficult. He wasn't starving. He wasn't hungry. He wasn't counting fat grams or carbs. And all of his diseases went away. All of his medications weren't needed anymore. And he's astounding today. He's 20 years younger biologically. And it's pretty miraculous. And then we see this on a regular basis. This is a result that most doctors don't see because they don't know how to apply the science of nutrition and lifestyle medicine, not just to prevent disease, but to treat and even reverse chronic illness.
Dr. Hyman, for our listeners that may not be familiar with functional medicine, if you could just give us a little bit of explanation what that area of medicine is about, and do we need to re-educate people because we're so used to going to the doctor and I have high blood pressure, here's your pill. How do we get out of that mindset?
Well, we have to realize that, doctors are an essential part of our culture and our life, and they're there for us to help us when there's an emergency. I use physicians for my family. It's not that physicians are bad or trying to do the wrong thing. We're just trying to treat diseases of lifestyle with medication, which doesn't make any sense. So I think you have to realize that there's a new way of thinking about disease. It's emerging from the science, and we call this systems thinking. I call it ecosystem medicine or functional medicine. It's really how do you connect the dots between all the different symptoms you have. People intuitively know I should go to a dozen different specialists and get a dozen different medications if I've got all these different complaints. If I have a rash and I've got irritable bowel and I've got joint pain and fatigue and I've got a little depression, a little high cholesterol and a little high blood pressure. I mean, these are all seemingly separate problems, and you go to all these doctors, but they're all connected. Functional medicine allows you to understand how the body functions and work with these basic systems in the body that get out of balance and create balance in the body in these systems, in your hormones, in your immune system, your digestive system, your detoxification system. And we understand how to do that in a way that creates health, and then diseases go away as a side effect. And that's exactly what we do with diabesity and with people with prediabetes and diabetes. We actually work on all these factors. For example, toxins may cause obesity. We know that the BPA from canned foods increases insulin resistance and diabetes. We know that PCBs from farmed salmon actually cause obesity and diabetes independent of calorie intake. So I think this is really important that we're understanding some of these other factors, food allergies, nutritional deficiencies, what we call diabetes starvation in the midst of plenty, but it's actually more than that. Often malnutrition and obesity go hand in hand. Kids actually who are obese now have scurvy and rickets because their diets are so poor. The only green thing they eat are Skittles. So, this is a problem.
Mm-hmm. Dr. Hyman, we have to take a break. Stay with us. We'll be right back. Change Your Attitude, Change Your Life now has a free monthly digital magazine that can be read online or emailed to your inbox. Each month, nationally recognized leaders in their field provide the information that you need to inspire and motivate you. We believe in a holistic approach to life, incorporating mind, body, and spirit. As philosopher Francis Bacon said, knowledge is power. Use the wisdom provided in the publication and apply it to your everyday life. Visit cyacyl.com for more information or to begin your free subscription. That's cyacyl.com. Welcome back to Change Your Attitude, Change Your Life. I'm Joan Herman, and our guest today is New York Times bestselling author and internationally renowned functional medicine expert, Dr. Mark Hyman. Dr. Hyman, before break, you started to talk about the term diabesity. And what I'd like to ask you, in relationship, the blood sugar levels that we have in our body, in relationship to weight loss, why is blood sugar so important to whether or not we're able to lose weight? Is it more than just counting calories today?
Absolutely. See, it's really not about the calories, believe it or not. You can, I don't actually limit the amount of food I eat. I eat until I'm satisfied and feel full, and my weight's stable. Now, if I start eating things that raise my blood sugar, right, if I eat poor quality food, if I eat lots of flour, if I have sugar, then I'm spiking my blood sugar. Now, when that happens, you produce insulin from your pancreas. And that is the problem, because when insulin goes up to keep your blood sugar normal, the side effect is that it stores fat, and it stores fat around your belly. So insulin is a fat storage hormone, and it also causes inflammation, which makes you store more fat. It screws up your hormones. For men, it lowers testosterone, which makes them lose muscle, which makes them store more fat. And women, it causes all sorts of hormonal problems that lead to infertility. It also causes problems with brain function and appetite dysregulation, so you're actually hungrier. You know, everybody knows, like, if they eat a giant meal for dinner and then they're hungry like an hour later, how does that happen? They had enough food. Why does that happen? It happens because any large meal will jack up your insulin. And when that's high, you're going to screw up your appetite and be hungry. So the key here is to balance your insulin level, and no doctors measure it. That's why in my book I talk about how to work with your doctor to get what you need, which is a guide that allows you to be an empowered patient and ask for the right tests. And it documents all the science and all the evidence. So when your doctor says, well, there's no evidence for this, you can say, well, here's 300 references. Why don't you do your homework?
Mm-hmm.
You know, it might not be a lack of evidence. It might be a lack of reading.
Right. Well, your book, The Blood Sugar Solution, was written for me. I do everything wrong, apparently, and I suffer pretty much from everything that you just described. So someone like me, who I think I'm eating well, but, you know, I maybe tend to eat too many apples or things that I'm thinking are good for me but are spiking my sugar, what is it that I need to do?
Well, I explain in the program, it's a very clear action plan in the blood sugar solution, and I have all sorts of very practical tips on how to eat and what to do and what to pick in terms of quality food. But if you focus on quality food first, if you get rid of industrial food, and then you learn how to create the perfect plate, which is combining protein, fats, and the right carbs, not no carbs, but slow carbs on your plate, that you will balance your blood sugar and you won't have to worry about any of these things. And you have to eat early and you have to eat often. You can't skip breakfast. Skipping breakfast is a recipe for weight gain. So you have to have protein for breakfast. It could be a protein shake. It could be eggs. It could be nuts, seeds. And you can then have a perfect plate for lunch and dinner, which is half of the plate should be unlimited refills of non-starchy veggies like salad fixings or broccoli or peppers. And then the other one quarter should be lean animal protein like chicken or fish, or vegetable protein, beans, nuts, or seeds. And then the other quarter could be a whole grain like brown rice. I love black rice because it's got a lower glycemic load and it's got lots of antioxidants, sweet potato. And then that's the perfect plate, and then you don't have to worry about it, and you can just use these principles to follow along. There's tips in the book on how to eat out, on eating well for less, on how to cut cravings, on 10 rules for eating safely for life. So it's really kind of goof-proof health.
And one of the things that I found interesting in your book is that you talk about food addiction. And so often people have this attitude when they see someone who's overweight that they believe that person just doesn't have willpower or they're weak. And you're actually saying that the foods that we're choosing to eat are as addictive as a drug. Why is that happening, and what are some of these foods?
I think this is really an important point. You know, we blame the victim. We say, oh, you're just fat because you're lazy and you eat too much and you're a pig, and just get yourself in control. And we blame the person who's sick. This is actually one of the most dangerous things we can do, because what we've discovered is that these industrial foods hijack your taste buds. They hijack your brain chemistry. It's like cocaine or heroin. It's like telling a cocaine addict or a heroin addict, well, just cut down, or just stop doing that. You need help, and it's a power. And in fact, when they put rats in a cage with sugar or cocaine, they always go after the sugar. So you have to realize that these foods are designed to be addictive, have hijacked our brain chemistry, have hijacked our palates, and we need to take them back, and we need to do it in a very specific way that I talk about in the book, how to detox from industrial foods. It takes a couple of days. It might not be too fun, but after that, you'll have your life back, and you won't be stuck in this vicious cycle, and that you can and begin to sort of get your taste buds and your brain chemistry and your hormones back in gear so that you don't actually end up with this chronic craving. And, the thing that I think struck me was when I saw Super Size Me, when he ate his first meal of supersized food, he actually threw up. It made him physically ill. And I've had this experience once when I kind of went to a baseball game and I ate some junk. I physically threw up because it was so toxic. And by the end of the movie, he only felt well when he was eating the junk food.
Mm-hmm. He had his fix.
The rest of the time he was depressed and tired and felt horrible, just like an addict who needs their fix to feel good. That's exactly what's happening. So we know this from brain imaging, and it's just an important thing to address that people can get over.
And I think as parents, we're going to try to reverse and save ourselves, but we really need to make these changes for our children because we're raising a generation of addicts. And it's just very scary to hear you say this.
Yeah, but you know what? Once people realize it, then they can be empowered to do something about it, and that we can overcome this, and it's not that hard. And that's really why I created this solution. And people don't realize they have the power to take back their lives in this way and conquer their demons. And it's not just because they have emotional problems or they're stressed or they're weak-willed or whatever. It's important to understand that there's a much better way to solve this problem.
Dr. Hyman, what about vitamins and supplements? What do you recommend, and what do we need to watch out for in the type of products that we select? Because I know some of the vitamins, people think, I'm taking a multi, I'm doing what I need, and they don't absorb well in our body. So what is it that we should really be focusing on daily, and how do we select the right product?
Well, I think, we need to eat a real food diet. That's number one. And then the supplements become a supplement, not a replacement. But we have to face the fact that we do need supplements given the depleted soils, given the way food's transported, given the stresses we have, the toxins we're exposed to. And I think we need a good quality multivitamin, a good quality fish oil, and vitamin D as basic supplements. And then there's some other things like probiotics and other things I talk about in the book that help boost metabolism. And, personally, I'm a physician. I practice medicine at the Ultra Wellness Center in Lenox, Massachusetts, and I've made it my job to find the best companies out there who are providing professional-grade products that have been produced in factories that follow USP guidelines for safe manufacturing, for clean products. They test the raw materials. They test the final lots. They look for contaminants. They look for the potency. There are standards that are followed by some of these companies, and that's really what I focus on, and I use them and find them clinically very effective. And I share them all on my website. You can find out what the best ones are at drhyman.com or on bloodsugarsolution.com. And for diabetes and diabesity, there's some specific extra things I recommend, like chromium and lipoic acid and a number of other things. So these are things that you can actually get to boost your metabolism, to improve sugar balance, and many other things that are in there. And the super fiber, which helps to reduce your appetite, it helps you lose weight, and reduces absorption of sugar and fats in your blood.
And finally, Dr. Hyman, our favorite part, exercise. What do you recommend that we do? Cardio, weight-bearing, a combination?
Yeah, I think, overall fitness is important, and we need all the components. We need to build muscle, strength training, or things that build our muscles. We need to be aerobically fit and do cardiovascular exercise, and we need to stretch and keep our muscles and ligaments loose and flexible. And all these things are part of an integrated fitness program. There are many ways to achieve it. I do yoga, I play tennis, I play basketball, I run, I do lots of different things. I don't really go to a gym because I hate gyms, but I think you can find lots of ways to play.
And I think the key is, as you just said, have fun with it so that you stick with it.
Yeah, if it's not fun, you're not going to do it. So I always make sure it's fun. Put on some music, do whatever you want to do, dance in your living room. I had a patient who was, she lost 125 pounds just by she was embarrassed to go to the gym. She was very overweight. She'd never exercised, but she loved music and she loved to dance. So she put on dance music and she just danced for an hour every day.
That's good to know that I'm not the only one.
Close the shades, yep. Pull down the curtains.
Yeah, please. The book is The Blood Sugar Solution by Dr. Mark Hyman. If you'd like more information about Dr. Hyman, you can visit his website, drhyman.com. That's Hyman, drhyman.com. Or as always, you can visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on our site, listen to past shows as podcasts, read the digital magazine, sign up for our mailing list, and now take part in the CYA-CYL Book Club. Dr. Hyman, thank you so much for spending time with us. I think that, the information that you shared here today, if anyone walks away with the most important thing for me, it's that we are empowered, we can take control of our health, and we don't need to be victims to disease.
That's right. Everybody has the power to take back their health. They just have to do it one bite at a time, one step at a time.
This is Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in.